Hi, my name is Jeremy Waking. I'm a physical therapist and owner of Advanced Physical Therapy Specialists. I wanted to talk to you today about low back pain. It's one of the most common things that we see in the clinic. There's lots of different things that can cause low back pain. Some can be serious pathology that needs to be treated by a physician. Other times, different parts of the body can refer pain to your low back. But the majority of low back pain can be classified as simple mechanical low back pain. That simple low back pain may not feel so simple. It can be pretty painful and limiting. So I would suggest following up with a physician or a physical therapist to determine your best course of action. Once you've determined that physical therapy is your best course of action, there's lots of options available to us. So if you come into the clinic with low back pain, I like to treat you as an entire patient, not just a diagnosis. So I'll look at how your ribs are moving, how you're breathing, how you're walking, how you're moving. We'll look at the entire body and not just your low back. That's going to get us the results that we want. So a low back problem can usually be broken down into three main categories. Number one, a mechanical dysfunction. That's if there's a tight joint, a tight muscle, a tight nerve. Number two, a neuromuscular dysfunction. There's this problem with strength or endurance. And number three, if there's a motor control problem. What I mean by motor control is, are the muscles turning on and turning off at the right time? If you don't address these problems, you probably won't get the results you're looking for. Most people will be a combination of all three. So if you come into my clinic with a spine problem, one of the common things I'll see is a muscle imbalance. That muscle imbalance can affect the way that your pelvis moves. So the common thing I'll see is this left side of your pelvis tips forward and rotates to the right. And what happens then is it starts to put stress on your low back, on your hips. You can start to get pain in the glutes, in your knees, even in your feet. I hear all the time from my patients who have seen other practitioners that the practitioners told them their pelvis is off or out of alignment, and I usually agree. But then I ask the patient, what did that practitioner do for you to keep your pelvis in that better alignment? And the patient usually doesn't have a good answer. It usually goes along the lines of something like, well, I was supposed to just keep going back and getting adjusted or massaged. Here's the difference with my approach. I'll give you a few subtle exercises to keep that pelvis in a good position and get you out of pain, correcting your muscle imbalance. The rest is a hands-on approach. Studies have shown that the combination of exercise and manual intervention provide a superior outcome. And I would add to that the combination of superior exercise and superior manual technique, given at the right time with the right thought involved, will provide a superior outcome. I've thrown a lot out there. If you have any questions or would like to set up a free phone consultation with me, feel free to give me a call at 720-357-4079. Talk to you soon.